Sarah, Martha, and Joanne.
You mean Sharon?
I'm sorry.
Is that Sharon?
It's Sharon.
Hi, my name is Sharon McClendon Price. I am, in Mary-Sue Clarkland's parlance, a single mother of 5 organs, once widowed, once divorced. That's why I'm here. I agree when a facility is not properly run, bad things may occur. And when these problems happened in Alabama, they were documented in inspection reports, and those facilities were closed. By review of internet available documents referred to only 6 deaths in Alabama since 1973. The latest occurring over 20 years ago in 1991. And as far as I can tell, none occurred at any clinic that remains open today. Apparently, the state of Alabama's health department is doing their job in regulating abortion clinics. That being said, this bill, as the others that we were against last year, such as the famous Probin bill and the famous Personhood bill, they have nothing to do with women's health. They have everything to do with circumventing the 1973 Roe versus Wade Supreme Court. There's no need in this. The clinics are safe. If there's not a safe one, send the health department out to check it. There's no need in carrying out. That's all I have to say. Thanks, and y'all have a good trip home tomorrow.
Thank you, ma'am. Martha.
Thank you. I'm Martha Morgan. I'm a professor emerita at the University of Alabama Law School. I'm presenting my own views today. I taught constitutional law for 30 years. I want to make 2 points. First, if House Bill 57 is about women's health and safety, then of course everyone's concerned about that, but I want to urge you to be sure that each of the provisions is really related to some documented health or safety concern. There's a stack of citations, but how many of those citations relate to the kinds of restrictions, particularly the admitting physician and some of the others that have been addressed? And because you're going to need that kind of evidence when the lawsuits come. Secondly, I would ask you to compare that to the health implications for particularly poor women and young girls if these restrictions are imposed and do lead to the closing of all clinics. I've done a lot of work in Latin America where there are very high mortality rates from illegal abortions, and there they say of these kinds of laws, rich women fly to Miami, poor women bleed and die from illegal abortions. We had that at one time in our country. Here maybe rich women in Alabama will fly to New York, but poor and young women, I fear, will bleed and die. Secondly, if this isn't about health, but is about reducing abortions or even trying to stop the number, there's so much more we could do. Education, health care, where women could get good jobs and be able to make real choices about what to do in situations. Better domestic violence laws and control of people using guns in domestic violence. Nobody thinks anyone should be coerced into having abortions.
Your time has expired.
There are many positive things we could do to address those issues. Thank you.
Thank you, Dr. Morgan. Joanne.
Hello, my name's Joanne Cummings. I'm from Decatur, and I represent a group of activist women who are concerned about this bill. Previously, they referred to only 6 deaths in Alabama being able to be documented online, and the last one occurred 20 years ago. If this statistic was being used for any other surgical procedure, it would be considered a remarkable safety record. But because these resulted from abortions, they are held out as glaring examples of malfeasance. Now, I regret all deaths caused by any malpractice or complications from any procedure, but I don't hear the same outcry for deaths from or complications from other types of operations like liposuction, tummy tucks, or any other cosmetic surgery, because statistically these things happen. Nationally, in 2008, CDC reported only 12 deaths from abortion. Statistically, that is 0.6 deaths per 100,000 abortions. In all of the years since 1973, when abortion was legalized, there were only 200 deaths that have been documented. On the other hand, the Journal of Obstetrics and Gynecology reported a death rate of 8.8 per 100,000 live births. So that this means that a woman is 14 times more likely to die from continuing a pregnancy that she does not want than from having an abortion. By shutting down clinics due to irresponsible regulations, they are condemning many more women to die because of forced births. By comparison, liposuction is reported to have a death rate of 19 per 100,000 procedures, and complications from colonoscopies are 34 per 100,000. Yet they wish to make abortion clinics subject to the same regulations as doctors' offices and as ambulatory centers, when there's no medical need for it. So how is this really about women's health and safety? In 2006, 55% of pregnancies in Alabama were unintended pregnancies, and of those, 23% resulted in induced abortions. 66 of all births in Alabama resulting from unintended pregnancies, a total of 20,000, were publicly funded at a cost of $6,000, with $2,600 being covered by the state. And if you assume that
Your time is expired.
it's going to cost you $13 million.
Thank you, ma'am. I'd like to thank each of you that participated in the public hearing. Obviously, these hearings are for the committee members to be able to gather more detail and information about issues that are being presented before the body. I'm going to ask Ms. McClurkin if she'll come back to the podium. And we will allow the committee to address their concerns to Ms. McClurkin, to allow her to answer any questions that we might have. So at this time, Mayor Sue, I will recognize any committee members that have questions. Senator Blackwell, I think you had a question.
Thank you, Mr. Chairman. I have about 5 questions, and I'm not sure if you'll be able to answer all of them. We might can look in the audience to see if anybody wants to help. First question, how many current clinics operate in the state of Alabama for abortions? Do we know? Is it 5? Okay. And in these 5 clinics that operate in the state, who is currently authorized to perform an abortion? I mean, is it a doctor? Does he have to be certified? He have to be board certified? So who actually can perform an abortion in these 5 clinics?
Well, in this bill, it would make it such that a physician with admitting privileges would perform the abortion.
I guess my question is, and maybe, Mr. Chairman, you might can help me, but if there's somebody can answer this question, who is authorized currently to perform the abortion in the clinic?
Well, Senator, I think, and anyone can correct me if they know better, I mean, I think a board-certified physician has the ability to do a medical procedure, including an abortion.
So, I guess my real question is, can anybody do one, or do you have to be a board-certified doctor?
I think you have to be a physician.
You
Yes,
have to be
ma'am.
a physician, and then you have to have a contract with a board-certified OBGYN physician if you should have a complication. But no one but a physician, even a medical abortion, the physician has to physically hand the pill to the patient and watch her swallow it.
Thank you. That helped.
All right.
Second question, or third question. If we upgrade these 5 abortion clinics to the standards of a surgery center or ambulatory health care facility, what are the upgrades that are needed for those facilities? I know you're not an expert in the facilities. I was just trying to get a handle on these major upgrades. What is the cost associated bringing these centers up to meet this code of this new bill? Another technical question for the audience.
Ms. Sue, do you have a comment on things that you're aware of?
It sounds like from what I've heard in this hearing today that they're already very safe and efficient, and so it shouldn't be a problem.
You've got an answer here.
Okay, Mr. Chairman,
Yes, ma'am, you're recognized again to try and answer Senator
That is
Blackwell's
not
question.
correct. This would require structural changes for ambulatory surgical centers, that we would have to make 6 feet wide corridors. We would have to have 4 feet wide doors. And all of our existing facilities are on land parcels that will not allow us to expand, which means that we would have to build an entire new facility. It would require beds or gurneys to be for every patient even though, like I stated in my testimony, we don't have patients who are heavily sedated. Our patients walk from the procedure room to the recovery room, and they walk from the recovery room out the door. They receive light to moderate sedation.
So the current 5 facilities wouldn't have to be upgraded, the expanding size of the hallways and the doors and things of that nature? Just like this committee room, couldn't that be done in the existing facility?
No, not any of our facilities, the building can meet those requirements.
Okay.
We also would have to meet the life safety code, fire safety code, which I can't go into details with that, but perhaps Charles can.
Okay, I'm good with that. Sorry.
Continue with your questions, Senator.
I've got 1 or 2 left. The requirement that the father's name be reported to law enforcement, I didn't hear anybody touch on that. In certain circumstances, I was just concerned about why we're requiring that and what the purpose is behind that.
Well, the purpose behind that is that if a minor becomes pregnant, there could be some other abusive things happening. If a 14-year-old becomes pregnant, and that would be something that the law enforcement would need to know about as well as DHR.
So it wouldn't be, I guess, everybody who came in, but just under certain circumstances.
Correct.
And then the certain circumstances, I'm not sure to define, but we'll look at that. I think that's it at this time. Thank you.
All right, Senator. Senator Coleman.
Thank you, Mr. Chairman. Representative McClurkin, I want to follow along the lines that Senator Blackwell asked. That was the question that I had on page 2. It says certain circumstances, but there was no definition. What is your definition of certain circumstances? Because it's an open-ended, it would include everybody. I'm not necessarily opposed to it, I just think it needs to be defined, because I don't want to leave it up to the courts to define it for us.
Well, I think this would be left up to the doctor to define the certain circumstances. You know, through examination, he can tell if it was the pregnancy was caused by some abusive act, or you know, it's just a lot of things that could be defined by certain circumstances that I don't think. I mean,
Well, we're making laws here, and I want us to be very clear that if it goes to court, because one of the person accused the wrong man, and you want to be sure that this is defined very clearly. Now, I can agree with you totally if you want to say in the case of a minor child or whatever. I do think if that is your intent, that needs to be specifically stated here in the bill. And I'm having some amendments that I'm going to offer, but before I go any further, I would ask that, you know, that we not try to pass this today, because I understand, and I'm not totally opposed to what you're trying to do here. I just think that because I can't say on one last year, it was all about the safety of women and their health and not going back to the coat hanger and things like that. I don't want to go back to those times of years. But at the same time, I want to make sure that the intent of this bill is what we intend it to be, if it's truly about the safety and health welfare of women. We find that in Alabama there are only 5 clinics, and of course, I haven't seen your stack of information that you brought out. I'd really like to take time and really read that. But I don't have time to read it today because you just brought it, and we were not privileged to have copies of it. But I would like to have time to go through it, because already we've heard some testimony here, based on the clinics here, based on the issues that they have had where they have been cited. They are very minor, and those clinics, like any other medical facility, if there are problems, they close them down. I did take time to go through and read this early after I found out, because I was online as I was trying to read the bill. But we already have, under our State Department, Alabama State Board of Health Divisions of Licensure and Certification, Abortion and Reproductive Health Clinics. And one of the things I would ask is that I'm having them draft it up, is that, they not be put in the same category as ambulatory, which is a different thing, that we do refer to them as reproductive health clinics because that's what they are. I'm for all the safety standards. I want to see every standard there is to protect women's and women's health, because I don't believe that we are going to dictate morality, and in essence, I understand that people have their own religious belief. But if you are going to be a medical facility, and if you're going to provide this service, we should have standards. I don't feel in this bill that you have that there's a level playing field though, and that's why I want to sit down, and we sit down and go through this, because I feel that they should be able to meet the same standards, following along the question that Senator Blackwell asked, that any other physician doing the same thing would meet, but not exceed.
You're absolutely correct, that it's not a level playing field.
Well, I haven't really kind of heard that, and you had a lot of documentation over there that I would like to have the opportunity to really read before voting on this bill.
Wouldn't you want your physician who removes your tonsils from your body to be in the same position as one who would remove a baby from your uterus?
Any doctor that's operating on any part of me, I don't care what it is. If he's putting in a false eyelash, I want to be certified, I want to be licensed, I want to be. So that has nothing to do with it. I'm about standards, but I'm about setting the same guidelines that we all follow. So that's why I said I want to take time. The other thing, last year, I had said that a woman's mental and emotional state should be a consideration. This group, this body right here felt that it was not. I see that is in the bill based on the lawsuits. So I have, that we should follow the same issue that we have for Malpractice Act, that all the other lawyers and all the other doctors, as I understand, are under that same act. Again, there are a lot of things in your bill that go beyond what other doctors, I think, are having to follow. And I'm just saying, if we're gonna do it, first of all, these are the standards. And if we're gonna follow these standards, let's follow these standards that we have. And then, is Dr. Williamson here? Because this is the licensure board of the State Board of Health. I would like to hear from Dr. Williamson, and that's the other part, because they are the ones that enforce this. So I would like to hear what he has to say about this. And that's why I'm asking that we at least not vote on it today. Give me a time to sit down and talk with you about your information that you have, and then I do have some amendments that I would like, and I do want time to explain them and not us rush through them so that you'll understand where I'm coming from. I'd like to see it pass, quite frankly, but I do think that there needs to be some modifications. Mr. Chairman, do you want me to discuss these now or later?
Well, Senator Coleman, what we can do, first off, let me ask, any other questions on the committee? Senator Fielder?
Representative McClurkin, if these existing facilities have to go to an ambulatory care facility, would they have to necessarily go through the CON process to do that? Or,
No.
Okay.
No, we did think about allowing them the opportunity to obtain the CON. That would make it a real level playing field.
Mr. Chairman, we had a ward one person privilege on. I just want to get a gauge from you as to what our schedule is today. The Senate Judiciary scheduled to meet at 1 o'clock around the corner. And I know Senator Coleman, Senator Fielding, and myself, we have several Second Amendment issues that we've got to deal with there. I mean, I do want to vote on this bill, but I want to kind of get a gauge from you as to our timing with my committee meeting around the corner. I know we're all kind of, we're crammed up.
I recognize that, Senator. Well, let me make the decision that the chairman makes. It was my intent today that we were going to vote on this legislation. And the reason is because this legislation has been out there for quite a while, because this is a House bill that's been vetted through a House hearing as well as all of the committee work in the House. And we have such a robust agenda, as is always the case in the Alabama Senate Health Committee. So it was my goal to vote the bill today. However, with some of the questions that we've had, our interest of time, some of the topics that have been expressed, and with Senator Coleman saying she's in support of the bill, but yet has some other concerns that she wants to be addressed, then I'm gonna make the decision that we are not gonna vote on this bill today. We're gonna vote on this bill without any public hearing or with minimal discussion, in our next meeting, which will be next Wednesday. And then we'll be able to continue to move the bill appropriately, giving us one more week to discuss it. But at this point, in the interest of time, with all the others that we have, waiting in the committee room for another piece of legislation.
Thank you, Mr. Chairman.
I think that's gonna be the decision of the chair today. Ms. McClurkin will request that you be back with us on next Wednesday, same time and place, to be able to answer any other questions that Senator Coleman, Senator Blackwell, and others may have. Is there any other comment? And Senator Ward, let me, before you jump and rush off, we're gonna have another public hearing here, and I'm going to require,
And I'm gonna come back.
well, I'm not gonna require, I'm gonna request that you and other colleagues, once you've made a quorum and are moving, that you can come back here for the vote on the next bill.
As chairman of the committee, I'll do my best to let some of the folks come back, but I may have to sit in the chair to preside over the meeting,
I understand.
but I will make it move quickly for you, Mr. Chairman.
And Mr. Chairman, I wish you would send me some kind of smoke signal when my bill comes up so I can run down and get my bill in your committee and come back and vote on
Before
it.
you send it, Donald.
So, at this time, are there any other questions related to House Bill 57 that we need to put on the table that's gonna be topics to be discussed in the next week?
I have
Senator Blackwell?
Section 20, I'm a construction guy. If we're going to move forward with this bill, which I'm in favor of, we need to look at Section 20. I'll discuss that with the sponsor.
Well, I'm gonna instruct you, if you will, to work with the sponsor and look with that, and also with the Senate sponsor to see if there's some issues where it can be modified. There's a way we can do that, without having to have a lot of amendments if they're agreed to language, and that's what we'll try to work with. So at this point, thank you for those that are here for the legislation being discussed, House Bill 57. You're welcome to stay, or you're welcome to go. We have another bill coming up for public hearing, and we're gonna move quickly to that if we can, and in the interest of time, this is gonna be on Senate Bill 229. Senate Bill 229, the public